Hello everyone. Welcome to a segment that we like to call Conversations with Recovering Individuals. Addiction is a serious disorder across the world. It affects countless peoples and their families. Recovery from addiction is seen to be a difficult experience. But through these conversations, we want to show that with the right kind of help, recovery can be a transformative experience as well. Good morning.
Good morning.
So, a little bit about yourself, an introduction perhaps?
I've done bachelor's in fashion management from London College of Fashion, and we have a chain of stores back in Delhi. We are into business of fashion, ladies apparel.
And what are you recovering from here?
I'm recovering from bipolar disorder.
And what would you say when you are in that state? So what would you say induces, if there's something that you think is a triggering factor?
Well, what I've learned in this Anunitha campus is that with bipolar disorder, even a little bit of alcohol, as I'm a social drinker, even a little bit of alcohol will not suit well, does not go well at all. It really kicks back and it really does not settle well, and it really amplifies and triggers the situation to a much worse situation. So that's what I really like to say, that alcohol and bipolar disorder and the meds which I'm having for bipolar disorder, the mood stabilizers which I'm having for bipolar disorder, do not go well at all.
And how long have you been fighting bipolar disorder?
By now it's been past 12 years I've been fighting bipolar disorder, and I've been on meds since then.
And if you had to look back, when would you say was the first time you started consuming alcohol?
I started consuming alcohol at a young age when I was in school, socially only. But at that time, no sign of bipolar disorder was visible. I was perfectly functional. I got into a great college. I aced my school and college and did well in jobs and businesses. And but slowly depression crept in, and with depression I was diagnosed. My doctor in Delhi's best doctors told me that you have bipolar disorder and depression and anxiety, so they put me on these medications.
So let's say you told me that for 12 years roughly you've been facing bipolar disorder. What is it that told you that you might need more help, since you have been taking a medication, but what is it that told you that you might need a rehabilitation experience or you might need more help?
Actually, my parents thought that because since my graph was going down, my career graph was going down, and because of bipolar disorder, I wasn't feeling so well as well. So they thought that they should put me in this campus, Anunitha campus, and they should also seek more professional help rather than just the OPD of Delhi's Vimhans. And they thought that it's a good idea to rehab me and put me in this campus.
How has your family helped you through the past 12 years? Because a diagnosis of bipolar disorder is obviously tough on you as well and them as well. So how have they supported you through this time?
To be honest, I have no words to express to you even that how much my family has cared for me, how much my family has supported me, especially my mother and my father and my sister, and even the extended family, how many extra miles they have traveled for me, how much trouble they have taken for me.
So you're from Delhi and Bangalore's pretty far away.
Yeah.
So how did you feel the first time you came here, in a faraway place, first time you stepped into Anunitha?
The first time I stepped into Anunitha, I was little jittery because it was my first time in a rehab and I wasn't doing well mentally because of bipolar disorder's relapse. So, but over the time, Anunitha has really helped me. All the counselors are really well trained, well educated, very caring, especially Raji ma'am and my sir, my counselor Ronit sir, and other teachers and counselors, and even my psychologist Dr. Suchita Mishra. She has been very instrumental in helping me and bring about a change in me, and telling me that how I can help myself, and how I really worked hard on myself, and how the parents have also worked hard with me.
And you did mention that you were a little jittery when you first came to Anunitha. What is it that helped you settle down in the first few days? What is it that helped you feel a lot more comfortable here?
Well, to be honest, it was a combination of my family, phone calls, support, and my clinical team's help. So a combination of both worked very well, and along with the meds, along with the medication Dr. Vishal was giving me, so that took aside the jittery part and helped me recover. And when I recovered, then only I could feel the fun at Anunitha, as it's a fun place also. I started discovering all the negative feelings which I had towards a rehab and why I was put in a rehab in the first place. All that vanished into thin air, and I was able to connect with Anunitha, and I started enjoying the place, truly enjoying my place, and discovered once again in life the subtle joys of the small joys of friendship, the kindness of humankind, and the love, the camaraderie, I would say. And all this brought about a real change in me, and it helped me grow as a person. It truly helped me grow as a person, and it's still continuing.
And so in rehab, there's also the treatment part of it, right? Therapies, group therapies, sessions. So how would you say that has helped you in your recovery? As you said before coming here, your graph was going a little down. How do you think it has helped you get back up and return as such?
Well, I would say that my overall experience in Anunitha has been a SWOT analysis. I have truly realized my strengths and my weaknesses, and the kind of opportunities and threats which I oppose in the real world. So the therapies and the sessions which are going on are truly helping me in reducing my weaknesses, in improving my strengths, in telling me that this is where I lack, this is where I should improve upon, and this is how I should help myself. And that's how the sessions are helping me. Some sessions like this ones with Atmika ma'ams, those sessions are truly very helpful in discovering one's own strengths, discovering one's own weaknesses, and truly removing one's anxieties and depression, and moving on from a place of past hurt and past pains and to a happier place in life.
It's been great speaking to you, and wishing you all the best for the future. Thank you so much.
Thank you.